in my history, never had a broken bone, stitches, no medical issues. I was diagnosed with bone cancer at the age of 18, and they removed my right leg just above the knee. And then I was diagnosed with colon cancer at the age of 48, and they removed my colon. I had this cyst pop up on my right leg right below the knee. When I worked out particularly, it would shoot pain down my leg into my foot. At some point, I went to the local student health center. The doctor x-rayed the leg, and he said he thought I had bone cancer. So I kind of discounted it and said I would check it out when I went back home. And so I did set up an appointment to go see a local doctor, and a month or so later, and they x-rayed it, and they said it was just a cyst. And then I went back to him several times throughout the fall, and he still thought it was just a benign cyst. And only into the spring, when it still gave me trouble and shooting pain, did he say, when you get out of school in May, we'll go in and take it out. So the surgery was set up after my freshman year, and he went in early surgery, early in the morning, as I recall, about 6:30, and he was going to come back out and tell me that everything was fine. But he didn't come back to the room immediately. Hours went on. That afternoon, I started thinking that maybe something was up. And as I recall, he didn't come in back to my hospital room until 6, 7 at night. And he was pretty emotional. He was a young doctor, and he said it was bone cancer, and he'd been testing it and sending it off. And that first night, he said, "You're going to have to lose your leg because of the cancer." And that was devastating, obviously. He said, "But we've got to do x-rays the next morning in your chest to make sure it hadn't spread." And so the next day I did x-rays, and he came in, and he got pretty emotional again, and he said that it showed up in the lungs. At that second day, he was talking about that I was going to have an iron lung and, as I recall, 30% chance to live. And so this was all obviously devastating, and I was just kind of in a fog. And luckily, day 3 was more encouraging. He came back in and said, "Well, good news. What was in your lungs was just blood vessels. And so you're probably not going to die, and you're not going to have iron lungs," which was a big relief. But he said, "You're still going to have to lose the right leg." He brought in a cancer doctor from another hospital, from a university hospital, and it was probably several weeks later when I actually had the leg removed. I don't remember the emotions specifically. I was shocked and scared, yes. It was interesting because one of the fallacies is people a couple of times have said to me, "Well, you've lost your leg, you've lost the colon, you this and that. So like I'm like Superman or something, I can handle pain. If I get a cold or a fever or a flu, I'm terrible. I'm not brave in that way at all." And the other thing that people might say to me that, "Oh, I couldn't go through that. I couldn't deal with that." And I would have said the same thing before I lost the colon or lost the leg. I don't know. You just deal with it when it's handed to you. But if you think about it ahead of time, like if somebody said you're gonna get cancer a third time or a fourth time, and I'd say, "No way. I'm bailing out. I'm not going to do it." Absolutely, I'd say that. So I don't think for a minute I'm more brave because I've been through it, and people rise to the occasion. You just deal with it. I think too, it seems to me the patient kind of goes into like a shock. They're there, but they're not there. It seems to be harder emotionally on the family members, but that's my experience.
Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. In most patients' cancer story and journey, cancer didn't start with the diagnosis. There may be some symptoms or a visit to the family doctor, urgent care, or student health, like you hear in Rick's story. In the studio today, we have Dr. Robert Israel, an internist in Mobile, Alabama. He received his medical degree from the University of Alabama School of Medicine. He specializes in internal medicine and has been in practice for 39 years. Dr. Israel is an internist in Mobile, Alabama at the University of South Alabama Mobile Diagnostic Center. Bob and his wife Cammie also happen to live around the street from me, and I get to see him walking his dogs every night, and he's such an amazing doctor that I asked him to be my husband's physician as well. Dr. Israel and I are going to talk about common and uncommon cancer symptoms, the early test, hearing the diagnosis, and learning how your family doctor works with your new team of cancer specialists to care for you and for your family. So, Dr. Israel, tell me your emotions just hearing that story.
Well, it's always tough to tell a 18-year-old they have cancer and they're going to lose their leg. I thought about how different it would be today if that same diagnosis was made, and how much easier the diagnosis would be today than it was probably 30 or 40 years ago. We have CT scans, and it would have been diagnosed probably in the first week and taken care of, and it probably wouldn't have required an amputation. We've got it a lot easier in some ways today as doctors.
Yes. And I think there is also a feeling that patients don't have to wait as long. You know, all of the unknowns that he went through with waiting to see what it was, then the biopsies, waiting all day to hear, then multiple tests to see spread. It seems much of that is compressed.
It's really simpler now than for us, the physician, and really I think it's easier on the patient because there's not that long period of unknown, which is I think the hardest part about cancer is when you don't know. It's actually easier once you do know because then you have an enemy and you know what you're going to do to fight it.
I always tell patients that this part from the day they see me or even before they see me leading up to the day of surgery or first chemotherapy or biopsy results is always the hardest part, the not knowing what you're facing. So, Dr. Israel, you see patients long before as a cancer specialist. We see them. You may have relationships with them for years and years before you ultimately are giving them a cancer diagnosis. Talk about that process, the relationship with the patient that ultimately brings them to you in that moment when they say, I know something's wrong.
Well, we sort of hope for health literacy with our patients, and we try to teach them the kinds of things that we need to know. So we ask questions in a manner that gets them thinking, well, I don't have night sweats now, but if I ever do, I'm going to tell that I have night sweats, or if I have unexplained weight loss, or if I have pain, a cough, difficulty swallowing, any symptom that's not there before but shows up, then if he's asking about that, it must be important. That trust that we've had because we've been seeing each other for years makes it a lot easier for me to say, well, that sounds worrisome and we need to do a CT scan or we need to do an endoscopy or something to make a diagnosis. And obviously they know if I'm doing that, I'm looking for something like cancer. And I usually tell them that's one of the things we're looking for. I say as soon as we know, we're going to talk about it.
When you mention that cancer word, what do you see? What do they feel?
It's variable from patient to patient. Some patients have said from the very first time I've ever seen them, the only thing that really scares me is cancer. And so when I say the cancer word, it's obviously shocking to them. Others, it's not so scary because they've dealt with it with family members or themselves. Certainly they know people with cancer who have survived, and that makes it a good bit easier than it was 40 years ago when I first started, because then cancer was a very bad thing.
Absolutely. I feel like so often I'm trying to explain to patients that it's not what it used to be, whether that is a surgery or a chemotherapy. And I think, again, what we are getting to with our listeners is really demystifying cancer in a way that shows what cancer is in the 21st century and how different that is from maybe even their most recent previous experiences. When you get that diagnostic test back and you know it's cancer, but they don't yet know that it's cancer, what's your first reaction?
It depends on the cancer. If it's a lymphoma, I know it's going to be very treatable and curable, and so I really feel like I've got good news. If it's pancreatic cancer, it's a little harder to deliver that message, but again, pancreatic cancer is curable now, so there are very few cancers that are not hopeful now. So I do feel we've got a diagnosis, we have an enemy, here's how we're going to approach it. And I guess for me too, when it's unknown, when I don't know what's making a patient lose weight or have pain or whatever the symptom is, I'm more worried than when I finally do know what the answer is.
I agree with that. The patients that you see that they know something's wrong and you feel that something's wrong too, but you can't figure it out, those are the ones that keep me up at night.
Right.
Yeah.
And, they're usually primed for the diagnosis. I mean, they know that we're either looking for cancer or an infection or something that we wouldn't be doing a CT scan or whatever if there wasn't something there. So it's frequently to them a relief to have an answer and then a plan.
The story talks about that the cancer patient is kind of in shock for those first couple of days, and that really in those first couple of days, it's almost harder on the family. How do you help the family to manage the diagnosis and to manage the patient's anxiety?
We always encourage the family to come to that post-CT visit or post-biopsy visit or whatever when we expect to have a diagnosis, so that they're there as well as the patient. And then willing and certainly happy to talk to the family as long as the patient's okay with that at any point during the diagnosis. And yes, it's a lot of times harder on the family because they didn't have the symptoms. They weren't expecting a diagnosis, and a lot of times they've been kept in the dark up until the time of the diagnosis.
I see that a lot. I think especially in the Southeast, especially among the matriarchs of our families, that children and husbands or wives with husbands who are not feeling well, that there's a certain amount of putting on a good face, and the reality can be much different. When we talk about you've given a patient presumptive diagnosis if it's a positive CAT scan finding that's consistent with cancer, but before the biopsy, how do you talk to people about Dr. Google, about internet access and what they might find and managing that kind of very fact-based but yet not personalized information?
A lot of times I've already talked about some other diagnosis.
As part of your previous relationship with them.
Previous relationship.
Yeah.
So I'd frequently say don't listen to other people's experiences because people are going to tell you you need to go to Baltimore or you need to go to Chicago or you need to go to somewhere. If you want to do that, we can certainly arrange that for second opinions, that sort of thing. But don't take a second opinion from your cousin or your grandmother and that kind of is the same message with Google.
Absolutely. You know, we tell patients MCI is an academic cancer center and just in line with the best in the world. I had this conversation last night that we had a patient referred to us from MD Anderson. So, you know, when patients are looking for a place to go that has everything they want, a cancer-specific doctor, specific clinical trials, that they can get all of that here locally. Right here, we're going to take a short break in our conversation. You are about to hear our innovation segment. On this and future shows, we're going to take a break so you can hear directly from the Mitchell Cancer Center cancer researchers on the latest breakthroughs in diagnosis and treatment.
Well, I'm Mike Finan. I'm a gynecologic oncologist, and for the last 4 years, I served as director of the Mitchell Cancer Institute and decided to get back to my patients, which is what I love doing. We're actually working on a screening test for ovarian cancer. Ovarian cancer affects worldwide, hundreds of thousands of women a year, over decades, millions of women. It's most commonly diagnosed in advanced stages, and in fact, 75% of cases are found in stage 3 or 4, where the cancer spread to the upper abdomen or even to the chest. And in those cases, there's only about a 25% long-term survival. So in other words, the majority of women with advanced stage disease die. So we believe that we can diagnose ovarian cancer up early stage 1 or 2, where you flip that ratio and now you've got an 80 to 90% survival rate or an 80 to 90% cure rate. We came up with the idea in 2008 to look at the fluid of a Pap test. No one had ever looked at that fluid. So it's been thrown into garbage for decades. But one thing led to another, and we discovered that this test really may help us screen for ovarian cancer, which was a much more difficult nut to crack, so to speak. So we've been working on this project for about 10 years, and we just completed a federally funded clinical trial where we partnered with over 20 sites around the country. And these sites included folks like Mayo Clinic, WashU, world-renowned sites. And we were able to distinguish a unique set of peptides or proteins, and we found some amazing results that hopefully will lead us to a screening test for ovarian cancer in the very early stages 1 and 2. So we're very, very excited, and the worldwide impact of this, just saving so many lives over time, it's incredible to think about.
It is amazing to me how I work down the hall from all of these amazing researchers and still don't know half of what's going on at MCI. We're going to now get back to our conversation with Dr. Israel. So, Dr. Israel, you've had that conversation with the patient. Presumably, there's probably a little bit more testing in their future as well as a visit to a cancer doctor. How does it work in terms of your office, keeping that team approach to navigate the patient over to the cancer center?
The patients are going to expect us to stay involved, and they'll be back in touch with us. In fact, in my experience, most of the time they come back after their first few. So maybe they see an oncologist, a surgeon, and a radiation therapist, and then they come back and say, well, here's what they told me. What do you think? And I'll say, well, that's all consistent. I'll say, maybe you need to go talk to the oncologist again because I don't think you really understood what they said, or I may make a call and see what the plan really is.
Oftentimes I find I'm referring back to the primary physician for surgical clearance or blood pressure control, things like that. So I do feel like it should be a very open conversation, obviously, with electronic medical records these days. A lot of notes going back and forth that help keep those lines of communication open.
I'm shocked at the complexity of most of our patients now. So we've got, some days in the office I see 90% of the people I see are immunocompromised because of cancer therapy or immunotherapy for skin diseases or joint diseases or GI diseases, and they're diabetic and they're hypertensive and they have congestive heart failure, and they're also getting a cancer diagnosis. And so that affects their other diseases and how they're managed. So we do have to remain involved. They may need more diabetes medicine or less, may need more hypertensives or less, usually less with cancer chemotherapy or whatever, but it does change all their other diseases.
Absolutely. We say chemotherapy is so much better now than it used to be. It's usually because we give them a lot of support medications, which can throw off other things.
And then I also encourage them to adopt a healthy lifestyle if they hadn't gotten it yet. But it does help immensely with that year of treatment, however long that year or 6 months or 18 months or whatever it is that they get. They do a whole lot better if they have a healthy lifestyle, exercise, work on their stress, that sort of thing.
You are a big proponent of healthy lifestyle, and I get to see it every day because you walk past my house with your 2 dogs. How do you start a patient on that road to healthy lifestyle, especially when they're staring down the barrel of a cancer diagnosis?
I hope I've started it before that. So I try to involve at least a couple of minutes in every visit with the patient on healthy lifestyle. So I encourage exercise, proper diet, that sort of thing. And I've kind of found that after people hear it a lot, it starts to sink in. And then I remind them of it because when you most need it is when you least do it. When you're most stressed, you quit exercising, quit eating right. And that's when it really does you the most good. So I remind them of that. And if they've been doing it before, it's pretty easy for them to keep doing it. They hadn't been doing it, then I encourage them and keep encouraging them and maybe offer them help from other people, dietitians, exercise physiologists, that sort of thing.
If you were to give a patient who's headed into chemotherapy, for example, 3 tips on healthy eating or a place to start from an exercise standpoint, what would you say?
I'd probably say eat your colors. So a lot of colored vegetables, colored fruit, and exercise. Remember, food doesn't come through the window of your car. And if your cereal changes the color of your milk, it's probably not good for you. So,
those are 3 good ones. I always recommend to patients after they have completed their therapy that the next step is to make an appointment with their primary care physician if for any reason they hadn't seen their doctor during the treatment. And then they come back to you, kind of now they've finished, they may or may not have treatment-related side effects and things like that. Where do you start?
I usually start with, so what's your understanding of your follow-up? How often are you going to be seeing Dr. Pierce? And, sometimes it's every 3 months, sometimes it's once a year. It depends on the cancer. And so then I say, well, let's be sure that you do that for however long it takes, 5 years or 3 years or whatever's recommended. And then I say, and I'm going to be watching for those reports. And then I say, and you and I are going to work on all the other stuff, the healthy lifestyle, making sure your blood pressure is controlled. If there's some complication of the treatment, then we'll deal with that. People get neuropathies from their chemo. They have issues from surgery. There are a lot of things that occur as a result of treatment. and we deal with those.
And as you have mentioned several times in our conversation, cancer affects the whole family. I would imagine there are scenarios where you're seeing husband and wife as both as patients rather than just as the caregivers.
Oh, yeah. I mean, a lot of times the people don't communicate so well. A husband's worried because his wife's breast cancer is being treated, but he has a real hard time talking to her about it. A wife can't communicate well with her husband about his prostate cancer or whatever. And so there's a lot of sort of counseling that goes into that. Then, of course, it sort of can. So if you've had cancer yourself and your spouse gets a cancer, it brings back bad memories of your cancer. And particularly for women with breast cancer, it seems to me that it just keeps coming up in the news. Or so even though it's been 8 years since your diagnosis, you read about a movie star or a royal or somebody who's got breast cancer, and it's really hard to sort of ever leave it behind.
Dr. Israel, thank you so much for coming in today. I've really enjoyed our conversation. For, the first half, I'm sure, of your career, patients thought that the primary care doctor was captain of the ship. In the 21st century, we really want the patient to feel like they're the captain of the ship. But I really appreciated how you talked about the role of yourself and all of our primary care doctors as trusted advisors, longtime friends of not just the patient, but also their family. And how one of our patients can use their primary care doctor or yourself to come back to the office after the oncologist visit to help with communication with their family members if it's something they're having difficulty saying, something that the oncologist thought was well explained but maybe not well understood, that role really continues throughout the cancer journey. And in particular, I really appreciated what you had to say about survivorship and the healthy lifestyle, how the patient comes back into the fold of the primary care office to live fully in survivorship and all that that means as a cancer patient.
Thanks a lot. I thank you for what you do. And I just want to tell the people listening that a primary care doctor can be a great resource for you and for each of your family members, even the family members who don't live here, who probably get third-hand information over the phone and don't understand it. We're happy to talk to them if you want us to, and happy to talk to you and expect to see you back on a regular basis, both during and after your cancer therapy.
Thanks so much for coming into the studio, Dr. Israel. I know how busy you are, and we really appreciate it.
Thanks, everyone, for listening to The Cancering Show with JYP, Dr. Jennifer Young-Pierce. Please subscribe, rate, and review this show on iTunes and anywhere else you listen to your favorite podcasts. Want us to deliver The Cancering Show to your email inbox? Contact us at cancering.com, and we can make sure you never miss an episode. We would love to know what you think about the show, or if you have any suggestions on topics you would like to hear. You can reach out to us on Facebook, Twitter, and cancering.com. Till next time, be healthy, happy, and always thriving.
This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond, with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.